Doctor, I think really right now we just want to kind of get into what is a thread lift and why is this something that people might want to consider as an alternative, again, to that traditional facelift that a lot of people have heard about.
Okay, before we had fillers, we could fill and give volume. We want to give that convexity, but we didn't have anything to pull. Right? So, you put fillers, but then you had the patient growing their face too big. So when we figured it out, somebody came up with it, take a thread that's attached to a cannula, and you put it into the skin, and then you pull back, and it has like these little cones, the part of like a fish hook that has the backward cone, and it clicks into the tissue. Now these threads, actually, when they stay there, they start building your collagen around the threads. The thread does dissolve or metabolize over 6 to 9 months, but you're left with your collagen. And then over time, you would do it again. But the thing is, with the threads in my practice, which is wonderful, is I'm able to use the lifting with the thread as well as the filling or the volume with the products. So I'd start with the filler, get the volume, and then do the threads. Down in the neck area, where we really don't put filler, you have that lifting, and it just pulls it right up. And it doesn't take very long. There is some downtime because we are opening the area with little needle, and we have to send it's a blunt cannula. It doesn't have a sharp point to it. The thread is attached to it and goes through, come out, clicks in. And then depending, we have to set the patient up. We put another one in over there, another one over here. And then we end up giving a nice lift. Patients could come back 2 weeks later, and we could do another or 2 or 3 if they need it.